As of February 24th, all remaining COVID-19 restrictions over in England were lifted, including the mandatory isolation of patients. It's been a month since then, and for a glimpse of the situation there, I have David Cox live on the line. David, it's great to have you on again.
Thank you for having me back on the show, Sunny.
Right, David, let's start with the actual COVID-19 situation there in England. Are cases on the rise or are cases on the decline there?
We have seen a particularly sharp rise again in cases in the last few weeks. So, funnily enough, in some parts of the UK, the last time COVID-19 numbers were this high was January 2021, which is before we had any vaccines available. So the latest figures suggest that around 1 in 20 people in the UK have tested positive for COVID. And I think the slightly concerning thing at the moment is that hospitalisation rates have started to creep up again in the UK. So that's the big thing which the government is keeping an eye on right now, because while there's still relatively few people in intensive care, that's one thing we want to kind of see whether that creeps up again.
Right. And David, given the status quo then, what are the chances of a return to some COVID-19 restrictions like quarantine in the case of infection?
Well, at the moment, there's no talk of any COVID restrictions being reintroduced. So the government is determined to press on with its living with COVID policy. The widespread COVID testing is actually going to end in about a week here. So it's going to make it a lot harder to keep track of any of the cases. So the main metric is going to be the hospitals and what the situation is there. At the moment, a second booster vaccine is being rolled out to all elderly people, care home residents, and all the vulnerable. So that is the main hope, that regular vaccinations are going to be the way that we can keep this outbreak in check.
Right. And keeping in mind what you just said, how is the public responding to the absence of free testing is it April 1st then, David?
I think the picture here in the UK is quite fragmented. I think people with underlying health conditions, so people who've maybe had cancer or people who've been transplant patients, they are very concerned about this because there's going to be no way of knowing really what the real rates of COVID in the community are going to be. A number of scientists, they have pointed out that also as well, like long COVID rates are on the rise at the moment, with more and more people getting infected and no restrictions at all controlling that. That could be an ongoing problem as well. But I think that the majority of the public, I think they're just still very keen to kind of see the end of restrictions and, for things to kind of get back to normal. But it's a bit of a fragmented outlook because it depends on everyone's situation.
Right. And moving forward, David, the World Health Organization claims England as well as France and Germany have moved prematurely with regard to the scrapping that is of COVID-19 restrictions. What has been the response in England to these remarks?
I think, yes, a lot of scientists are agreeing. I mean, as I said with long COVID, a lot of scientists are pointing to the fact that that is on the rise. And at the moment, the UK's approach to COVID doesn't really take the impact of infections particularly very seriously. And some people are saying that we could end up with a generation here affected by disability, particularly through long COVID. And we don't have any treatments really for that at the moment. But then again, it's a tricky situation because, vaccine fatigue is becoming a very real phenomenon within the UK. We're moving on to the fourth range of jabs, and there's increasing numbers of people who are saying they're not going to have them, even though we know that immunity does wane after a few months. So it's a difficult situation. The scientific world is still taking COVID very seriously here, but it's the government and the public, not so much.
Right. And David, reinfection appears to be yet another challenge amid the spread of Omicron. How are authorities there responding to this reality?
You're very right. I mean, I think there's a lot of people, particularly with Omicron, who are getting infected for a second or a third time with COVID. And one of the reasons for that is that we know that if you got infected with the first original COVID variant, it doesn't really give you that much protection now, 2 years on, against Omicron. I think the main thing as a government is just not going to make any changes really at all unless the number of patients in intensive care starts to increase again. Because if that happens, then and we start getting a backlog of cases within the NHS, which are really clogging up wards, then the government will come under more pressure. So I think we're just going to have to see over the next few months what happens, whether that changes, and then whether Boris Johnson is forced to do a U-turn.
Right. And David, has there been any more information about the stealth Omicron over there?
Yes, so the latest resurgence, it's thought to be a combination of both the stealth Omicron and also there's a new variant which has literally just started to emerge in the last couple of weeks called Deltacron, which is a combination. It appears that both the Delta and the Omicron variants have combined. So BA2 is a form of Omicron, and it's the form of Omicron which has the most mutations. And so the spikes we're seeing could be because BA2 is more transmissible, a little bit of waning immunity against infections. So people who were last vaccinated in the autumn could have less protection against COVID. And also the relaxed measures mean that BA2 is more easily able to spread from person to person. But the good news that we do have in the UK is because with the vaccine campaign, the boosters do seem to be very effective at preventing hospitalization. So people who get a booster jab, their chances of getting hospitalized or dying are less than 90%. So I think that is the key thing. That's the reassuring thing. The vaccines do still seem to be able to do their job against BA2.
Right, that is good to know. David, one final question before you go. Here in Korea, there have been severe difficulties in making funeral arrangements given the alarming surge in the number of COVID-19 fatalities. What is the case there in England like? And are people who passed away from COVID-19 allowed to have a traditional burial ceremony?
Yeah, well, we've seen the news about the funerals in South Korea, and I think it's shocked quite a few people. The situation here in the UK is quite different. So I think the good thing is that the death rate is relatively low and it has been under control, even though we've had these rising spikes of cases of Omicron and now BA2. So I think the number of deaths it's from COVID in the UK at the moment is less than 200 a day. So we haven't had funeral services coming under a backlog like 2 years ago. There are still some restrictions. So, for example, if someone is known to have died from COVID-19, then social distancing has to be put in place. There has to be a restriction of the number of people who can come to the funeral. But I think even that might start to end as of April. So the situation with funerals is quite different. And I mean, people have been quite startled to see the situation in South Korea.
Right, I see. Hopefully our situation will improve in the near future. David, as always, thank you very much for making the time to join us live at this very early hour.
Thank you.